Using the right mobility aid can reduce the risk of falling, reduce pain, compensate for neurological impairment, and improve confidence. Unfortunately, some of these aids are acquired through informal sources without seeking advice from a health professional. As a general rule, the larger the mobility aid, the more stable it becomes. However, the trade-off is walking speed and access to different environments, which is often reduced. The most common type of wheeled walker come with 4 wheels, but some have 2 or 3 wheels. Tri-wheeled walkers, sometimes called delta frames, have a single front wheel and 2 rear wheels. Most models will have a seat, basket and height adjustable handles. There are 2 types of brake systems on wheeled walkers: cable or spring-loaded push-down brakes. The cable brakes can be locked prior to sitting or standing. The majority of these walkers will fold down for easy storage and transportation. The user of this type of frame will need more support than a stick, but can still walk reasonably well, weight bear equally through both legs, and can manage longer distances. The aid can be used if a person lacks the upper limb strength to lift a frame. Wheeled walkers should only be used on smooth, level terrain. People with Parkinson's disease may prefer wheeled frames instead of pickup frames. Patients should be wearing the appropriate footwear, standing in a natural position with arms hanging down by the side. In this position, the hand grips should be at the height of the wrist crease. The person using this walker should be standing upright. Once the user has established good balance, brakes can be unlocked if applicable prior to walking. When walking with the aid, it's important to stay within its base of support, with the frame at a comfortable position in front of the body. The brakes can be used to slow the walker down if required. Do not bend with the walker too far in front. This will lead to the person leaning too far forward and bending at the hips or back. When turning, try to avoid turning around on the spot. It's important to walk in a wider turning circle. The user's feet should remain within the wheels when turning. Stepping outside of the wheels can reduce stability and increase the risk of tripping on the wheels. Do not pull on the handles of the walker to stand up, as it may overbalance. A much safer method is to push down on the bed or chair to stand upright. It is also important not to sit in a chair or on a bed whilst still holding on to the 4-wheeled walker. Always feel for the arms of the chair or the bed before sitting down. When sitting on the 4-wheeled walker, ensure the brakes have been applied first. The 4-wheeled walker is not a replacement for a wheelchair. A person should not be transported while sitting on the seat, as there is a high risk the walker will tip over if the ground is uneven. Avoid overloading wheeled walkers. For example, shopping bags can make it harder to push and cause the walker to tip. Mobility equipment must be inspected for signs of wear and tear. Always check for signs of bending, deformity, breakage or corrosion. Protruding or missing screws, split or loose hand grips, worn rubber tips, the safe user weight limit sticker. Always wear well-fitting footwear with non-slip soles. No thongs, loose slippers or socks. When outdoors, take care on wet or uneven surfaces. Frames should not be used on stairs. When prescribing a mobility aid in the home, check for and eliminate any trip hazards such as loose rugs, power cords or cluttered furniture. If the person using the mobility aid has stronger leg strength in one leg, turn toward the stronger side to provide more support. Where possible, these aids should all be prescribed by a trained health professional, such as a physiotherapist or occupational therapist. For more information, contact your local hospital physiotherapy department. Other options in the community may include private providers, local pharmacies, or local health equipment suppliers.